You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. Hot topic these days. And with us, we have an expert on the topic. He is known all over the world for his work with breast surgery, breast lifting. He's got medical texts. We could go on and on. Dr. Neal Handel, welcome to the program.
Thank you. Pleasure to be here.
Now, for people that don't know you, let's talk a little bit about your background and training with your work at UCLA. You lecture.
Well, I'm a board-certified plastic surgeon. I've been in practice for more than 30 years now. Associate clinical professor at UCLA.
Right.
Frequently invited as a guest lecturer, featured speaker, and even to perform live surgery for audiences of plastic surgeons, not only all around the United States, but throughout the world now.
So mommy makeover, for a working definition for today's show,
Okay.
What is it? What's involved?
Well, I think having children is certainly one of the most gratifying and wonderful experiences that any woman can experience in her life. And it's very rewarding, but it's got the flip side. There can be consequences to pregnancy as far as the physical effect on a woman's body that can leave her feeling sad, depressed, unhappy about her appearance.
Do they tell you, like for example, on a typical mommy makeover, and we're just calling it mommy makeover,
Yeah.
but after pregnancy, I guess her body's not bouncing back the way she wants. What do they say?
First of all, one thing that I'll hear quite a bit is they'll say, you know what, I love my 3 kids, but they just beat the heck out of my breasts. They destroyed them. Or, I used to be proud of the way I looked in a bathing suit. I won't wear a bathing suit in front of anybody anymore. Women that are embarrassed. I have women that don't want to turn the lights on at night in the bedroom with their husband.
Okay.
Because they're embarrassed about their breasts. They're embarrassed about their stretch marks. They're embarrassed about little accumulations of fat that they can't get rid of despite being vigilant in their diet and really active in exercising. There's just areas of the body that they, because of aging, because of pregnancy, because of some of the normal physiologic changes that take place, they can't get rid of them. That is the area where we can do so much to help these women now.
Now, by the way, okay, so you've been a plastic surgeon for 35 years.
Been in practice for 35 years, yeah.
What have you learned? What could you tell us men about the aging woman or woman after pregnancy, and what have you learned that we need to know?
Well, I think that really the important focus of this is really the patient's own feeling of self-confidence and self-esteem.
Okay.
I'm sure that many husbands, and I know this is true because the husbands will say it right in front of me and their wives, say, honey, I love you the way you look. You don't have to change anything about yourself. You don't need to do anything for me. That's good, because the patient should be doing it for herself.
Okay. But do you think some men get in the way of that?
Yes, I do.
And maybe they're insensitive to the fact that they want.
Not only are they insensitive, some of them are, frankly, don't want to spend the money. It's like, hey, honey, you're okay the way you are. Let's go out and get that, new powerboat that I want to get.
Okay.
So
the question is, what have you learned? I mean, what insights, what observations have you made, and how important is it that if you don't like your body, do something about it? That's my question.
The observation that I've made, frankly, is that small changes in physical appearance can create enormous changes in self-esteem, self-confidence, a patient's general level of happiness in life. I mean, if there's something about your appearance that you don't like and that bothers you and that you kind of focus on and upsets you and depresses you, and we can change it in an operation that takes a couple of hours, well, I mean, change it. Let's do something about it.
You say, we've talked on the phone, I've had you on the show talk about breast surgery, but that you're changing some people's lives. For some people, it's a complete,
you know what, it's funny because a lot of my colleagues in other specialties that, that are not plastic surgeons, cardiac surgeons and neurosurgeons, they will trivialize plastic surgery and cosmetic surgery, and they consider it something unimportant. If they saw the kinds of changes that I see in people's lives as a result of procedures to enhance somebody's appearance, to get rid of a feature that they don't like, I mean, these things can be totally life-changing. And we're talking about improving the quality of somebody's life for the next 10, 20, 30, 40 years.
Do you ever run into people that give you credit for kind of launching them into either a new career,
absolutely,
a new husband, a new partner, whatever?
Absolutely. I mean, I've had many patients who didn't feel confident around men, had a hard time dating, were insecure about their appearance, who, they'll come back with a big smile on their face, I've got a new boyfriend, or I'm getting engaged. You know, it's just...
You hear that, really?
Absolutely, and it's so gratifying to me. I mean, I'm smiling because that's just a great thing to hear from a patient. You know, I can really share in the joy of the change in their life that this has brought to them.
Are you ever surprised after all these years, after you do something and then they're just maybe happier than you thought?
Yes, absolutely. I mean, sometimes even I'm surprised how a little change in physical appearance can create an enormous change in a person's attitude towards life. Let me give you an example.
Okay.
A lot of times patients will come in because they've got some saddlebags or something, and we do some liposuction on them, and then they feel better about the way they look. They're more confident in their appearance. They start to go to the gym. They watch their diet. They're more vigilant about exercise. And they come in for maybe their 6-month post-operative visit, and I see a complete change in their body. It's not just the liposuction. They're a different person. I go, you look phenomenal. Yeah, I lost 20 pounds. I feel so much better about myself now. I'm really taking care of myself. So it's really an amazing experience for the patients and for myself.
So back to the kind of the definition of, you know, mommy makeover in your definition.
Yeah.
So what are the procedures you're doing?
I think, you know, mommy makeover really is a term that refers to what can we do to enhance the appearance of somebody who may have experienced some adverse or negative impact on their appearance as a result of pregnancy, childbirth. It can really affect the patient from head to toe. We're talking about changes in the eyelid area, the face, deepening of the creases, the smile lines, clearly laxity of the breasts, loss of breast shape, loss of breast volume, loss of cleavage.
You do a lot of neck lipo as well.
Absolutely, neck lipo, neck lifting. So really head to toe. Obviously the abdomen is an area. The abdomen, the hips, the thighs, the entire torso can change as a result of pregnancy and childbearing. So mommy makeover really refers to a whole spectrum of procedures that we can offer these women. Obviously, we're going to focus on the areas that concern them. I mean, you know,
you have a lot of, by the way, people watching this, some of these photos are very graphic, and the changes,
well,
I've never seen anything quite like this. I don't think anybody's seen anything quite like this.
Well, it's funny that you should say that, because these are things that I see all the time, but these are things that...
Is that right?
I do, because women obviously are coming to me with their concerns, but these are things that they hide from other people. I mean, if somebody's embarrassed about the way their abdomen looks, they're not going to go to the beach or the swimming pool in a two-piece bathing suit. If they're embarrassed about the shape of their legs, fatty bulges in the saddlebag area or the inner thighs, they're not going to wear shorts. They're going to wear long flowing dresses. So, you know, they want to hide it from their girlfriends. They want to hide it from their husbands because they're embarrassed about their appearance. They're self-conscious. And we can do things that can change these areas of the body dramatically. I want to show you a few examples. And as a consequence, change the patient's self-esteem tremendously. Here is the typical kind of patient we see. She's a young woman who's had, 2 children, I believe.
This is a young woman?
Relatively young woman, in her late 30s or early 40s.
What's going on there with the stomach
What's happened
area?
here is that, you know, not everybody's skin reacts the same to pregnancy. Obviously, when you get pregnant, the abdominal skin and muscles stretch a tremendous amount to accommodate the fetus, the baby. And once the baby's delivered, to a greater or lesser extent, those tissues are going to shrink down. But the elasticity of different people's soft tissues...
It doesn't happen to everybody, obviously.
No, there's some, it's amazing. I see some women in their 60s who've had 3 kids. They could still be doing, you know, Sports Illustrated bikini shots. You see other women who've had 1 child.
And this kind of wrinkling can happen.
And they can have severe, what we call striae or stretch marks, laxity of the abdominal muscles. They can develop a hanging flap of skin, what we call the abdominal pannus. All of these things can be treated surgically very effectively. I want to show you what this lady looked like after a tummy tuck. Look at the after photo of this patient. This is about 3 or 4 months after surgery. It is a dramatic change. Her tummy is flat now. The scar is so well hidden that it can be hidden beneath her underwear. Now, there is
what about all that skin, though? See, that's the question. I don't think I've ever really understood the tummy tuck.
All right, you know, basically a tummy tuck, it's a pretty simple operation to understand. It's kind of like pulling down a window shade and trimming off the bottom half and throwing out the bottom and stretching out that tissue on top.
So that skin's gone? That wrinkly skin I see?
That went into the trash in the operating room.
Interesting.
Right out with the rubbish. Now, there is a tiny scar around the belly button. With time, that tends to fade and heal. But the overall improvement in the aesthetic appearance of her abdomen, I think, is dramatic. Look, this is a woman, and you can understand why, who was embarrassed to wear a bathing suit in front of other people. She was ashamed of the way that her stomach looked. That's understandable. But afterwards, she's happy with the way her tummy looks. It's flat. We've gotten rid of all the stretch marks, all the wrinkles. The scars are barely visible. They're really unnoticeable.
So she's at the pool.
She can be out by the pool. She can be in Cancun on vacation, wearing a bikini, any kind of revealing attire, and really feel confident about her appearance.
Because in a dress, one thing that is attractive in any woman is that flat stomach.
And
just like with guys, right? With flat stomach.
Right. And that's correct. And there's more to a
tummy tuck.
Because
in a dress, this must make
it makes a big difference. That's exactly right. And I'm glad you brought that up, because part of a modern tummy tuck is not just removing the lax skin and the stretch marks, but it's also recontouring the underlying muscles. We actually take the deeper tissues, the muscle and fascia, and we put stitches inside that are kind of like a corset. So we can actually not only flatten the tummy, but give more of an hourglass shape to the waist.
So if it's a little bit of a bulge, like that inward, like no fat on the stomach, but you see that bulge.
Correct.
Oh, so you're tying it together.
Yes, we could take a patient who really is thin. This woman's thin. We can take a patient who's very thin, doesn't have a lot of excessive fat. We're not removing excessive fat. We're tightening up the lax skin, discarding or throwing out the stretch marks, and perhaps most importantly in these women who have a bulging or protuberant abdomen, we're actually tightening up the deeper layers. We're putting in
the ab muscles.
The abdominal muscles and fascia. Okay. Correct. We're putting in stitches that simulate what a corset does. So it's kind of like having an internal garment to hold things in shape.
So the incision, I guess, is well hidden below the bikini.
You know what? I specifically, when I do these surgeries, I have the patients bring to the surgery center on the morning of surgery. I ask them to bring the underwear or the bikini or swimsuit or whatever that they want to hide the scar, and I mark it on their abdomen.
Okay.
And I make sure that we design the incision so that the scar is going to be completely hidden. So it's going to be beneath the line of their bikini bottom or their underwear.
So when they come back in after it's all healed up and everything, they're wearing things that are different.
Oh, absolutely. Well, they're often come in dolled up, really proud about the way they look. They got their makeup on, they got their hair done, and it's great because they just they exude self-confidence. They're proud of the way they look. I guess one of the negatives is that they sometimes have to go out and buy a new wardrobe. That can get costly. I know some of the husbands have complained about that. But I think in the end it's worth the investment. Really to improve somebody's feeling of confidence, to make them feel pretty again.
Confidence is sexy too.
Absolutely.
I mean, you go to a party and a woman's laughing and she's mixing it up, and that's attractive.
You know what? I think that kind of inner beauty really comes from a high sense of self-esteem, a good sense of self-worth.
So they get that back sometimes?
Absolutely. I mean, that is so integrally tied to your perception of what you look like. I mean, we all have had the experience of good days and bad days. You get up and look in the mirror and you go, wow, I look pretty good today. I feel good. Other days you look in the mirror and it's like, whoa,
not so good.
I don't want to go out in public looking like this. It affects your attitude. It affects your mood. It affects the way that you interact with people. So,
that's a good point. When you don't like what you see in the mirror, it doesn't make you feel good.
No, it doesn't.
And these women, especially like this, they don't like what they see. So when you put them to this.
Correct. We can make a huge change. A change in their external physical appearance and in their internal psychology, in their feeling of self-esteem, of self-worth, of confidence.
Is there a lot of, and by the way, because we haven't talked about technique, people need to know associate clinical professor, UCLA, written medical textbooks teaching other plastic surgeons how to do the procedures we're talking about. Is there a lot of different ways to do this?
There's a lot of subtleties.
Is there a lot of technique in this?
We often combine liposuction with abdominoplasties, and I think experience is important because there can be an increased risk of complications sometimes when we combine procedures. So in a mommy makeover type of situation, we may be dealing with the breasts, with the abdomen, and with some liposuction all at the same time. And I think that's where the surgeon's experience and most critically his judgment is extremely important.
Has a plastic surgeon ever sent you one of these mommy makeover type of patients?
Plastic surgeons send me patients all the time who have situations that they feel are more complex, more prone perhaps to an unhappy outcome or a complication.
So the wife says, what am I going to do? We need to call Neal Handel. It's a long drive, but it's worth it.
Well, I'll tell you that I've had...
I mean, people fly in to see you?
Oh, absolutely. Yeah. No, I'm from halfway around the world, just this week, in fact. Now, I get a lot of patients from out of town, and from out of the state, and from out of the country.
I'm not trying to side with you, but I mean, you're one of these guys. I mean, you have 60 published articles in journals.
In peer-reviewed medical journals. That's
And
correct.
okay, so you have other photos.
Yeah, well, I want to show you a couple of other examples of women, who've been ravaged, if you will, by childbearing. This is kind of a typical sort of patient
my
we
goodness.
see. She's a recent patient of mine. Just saw her a couple of weeks ago, in fact, in follow-up.
And you're saying this is common. There's a lot.
Yeah,
of
very common. Yeah, I mean, this is the typical appearance of
Wow.
not every woman, but many women who've had. She's got 2 children. They're teenagers now, and she had a combination of some liposuction and a tummy tuck. That's what she looks like about 3 months after the operation. So the scar is going to fade more than that, but there's a total change in the cosmetic appearance of her abdomen. It's flat. We've gotten rid of virtually all the stretch marks, all the unsightly bulges. It can make a huge difference.
Now that one over there, that's.
You know what? I want to tell you a little bit about this patient. In recent years, we've been seeing a growing number of women and men just like this, who, because of the popularity of the lap band and other types of bariatric surgery, are experiencing significant weight loss, sometimes 100 pounds, 150 pounds. And obviously, for most patients, that's going to result in devastating changes in the appearance of the abdomen, the arms,
goodness.
the breasts, the thighs. This is a woman who lost a lot of weight.
How old is a person like this?
That patient is in her early 50s, and she's probably lost about 120, 130 pounds as a result of bariatric surgery. And, the only way, I don't care how much exercise she does, I don't care what kind of diet she goes on, what kind of creams she applies, nothing is going to eliminate that problem the way plastic surgery will. And here's what she looked like after some liposuction and abdominoplasty. A complete reconfiguration of her torso. Got rid of all that lax skin.
That's a big difference.
Yeah, it is. It's a dramatic difference, not only in the appearance of her abdomen, but you might notice, we can't really show the breasts on this television program. But
You can see the bottoms there.
yeah, as is often the case, we will combine abdominal surgery, liposuction with breast surgery. We did breast augmentation on this patient, made an enormous change in her breast too, just as dramatic as the change in the appearance of her abdomen.
This is like a completely different body.
Yeah, and it has a
What
huge...
do they say when it's all done? When it's all done.
It's life-changing. It really is. I mean, you can imagine looking like this before and looking like this after surgery. It really is life-changing.
Interesting. Very, very interesting. Would you like to see more of these patients come in?
I would, because these patients are justifiably proud of what they've accomplished. For many of these men and women, a lifelong goal has been weight reduction, to lose significant amounts of weight. And when they finally accomplish that goal, and we don't, by the way, do this until they've maintained a stable weight for at least a year, so that we know they've successfully and permanently lost the weight, they're often left with these redundant rolls of skin and excess hanging flab. And we now have phenomenal surgical techniques whereby we can recontour the abdomen.
their clothing, everything
abdomen.
must be different.
You know
for
what?
these people.
Even the arms. Let me show you this lady. Here's a patient,
Okay.
young woman, who's got laxity of the skin of her upper arm. You can see that hanging, flabby skin. She's embarrassed about
Is that a
wearing-
lipo? I mean, you're going to do lipo?
No,
on
I'm
that?
not going to do lipo on her. She's a patient who's got not only extra fat, but extra skin. Just lipo alone might even make her look worse, because it's kind of like deflating a water balloon. It's going to be more saggy. So, in addition to lipo, we do what's called a brachioplasty or an arm lift, and this is what she looks like. That photograph's about a year after surgery. The scar is well hidden, and it entirely changes the contour of her arm. So this is a woman who would not wear a short-sleeved blouse, wouldn't expose her upper arms. Now she will.
Now we're going to have, for the sake of time, we have to move to what you're doing for breast lifting, incisions, what the different techniques are.
I understand that, and I want to get to that. But I brought a little surprise for you here, because I know we're talking.
You have a surprise for me.
I have a surprise for you, because we're talking about mommy makeovers, but I want to show you what you might want to call a daddy makeover. This is actually a young man, about 30 years old.
He's young?
Yeah, young guy.
Oh my goodness.
He's 30, 31 years old, and on his own, he lost more than 100 pounds, didn't have bariatric surgery, didn't have a bypass, didn't take any kind of drugs, just worked out, dieted, and followed a careful regimen. He lost that weight, and you can see what he looks like. He's got all that lax, hanging, flabby skin. This is a young single guy, embarrassed to go out to the beach and wear a swimsuit, embarrassed to walk around without a shirt on. It's very self-conscious.
So when you
about
saw that, were you even a little bit worried?
No.
No. I mean,
when I saw that, I said, this is a home run waiting to be hit. So I went to
good for
bat
you.
with that one.
Wow.
And there he is, and I do think that's a home run. There he is after a combination of an abdominoplasty, basically the same operation we do in
You
women.
can see his obliques right there.
Plus some liposuction to further refine the contours. And I mean, it is obviously
Gee.
life-changing, really dramatic. This guy is now confident. in dating women. He's not embarrassed about taking his clothes off. He's not embarrassed about getting undressed at the gym. Not embarrassed about being at a swimming pool wearing a, without a shirt on. I'm very proud of him.
So like anything else, I guess medical procedures, early treatment. Okay, so you say wait a year, maintain the weight.
We want to make
They've
sure
lost
they
100 pounds.
Right, maintain the weight.
Why is doing it earlier better?
Well, I'll tell you why. Because patients are often very happy with the weight loss, but very unhappy about the way they look. They're still not comfortable with the appearance of their body because they got this lax, hanging skin. They've got flab they can't get rid of. They can't wear the kind of clothing they like to wear. We can do something about it. So, the sooner we do it, the happier they're going to be, and the longer they're going to enjoy the results of their weight loss and the body contouring surgery.
You think some people wait too long? Many years of not feeling good?
There's a variety of reasons that people put off surgery. A common one is just fear of having surgery, fear of anesthesia. So yes, I do think people sometimes put it off for that reason. And they could really derive a lot more joy for living if they went ahead and dealt with these issues.
So men and tummy tuck, same thing. You can pull in that girdle, the stomach muscles, you sew them together, so to speak.
You can think of it as...
I didn't even know men were getting tummy tucks, really.
Well, the majority of tummy tucks are in women, but men most certainly get tummy tucks. And with the recent explosive increase in the popularity of bariatric surgery, massive weight loss surgery, there's more and more men who are candidates for these procedures.
Okay, good. And you're the go-to guy for this?
Absolutely. Love to do this kind of stuff.
So you'd love to do more of them, obviously?
I would, because it really is life-changing for these folks.
But Santa Barbara, everybody's healthy over there.
Well,
when I travel there, I'm thinking everybody's in great shape.
You know what?
Here.
Santa Barbara, I once read an article, has the reputation of being the city with the best-looking people in the United States, and I'm relocating my office there because I want to make sure that they keep that reputation.
Good for you. Good for you. So moving on to breast surgery, breast lifting with the Mommy Makeover.
All right. You know what?
And this is your specialty.
You know what? You've really honing in now on something that's very interesting and important to me, and that is in women who come in for improvement in the appearance of their breasts after pregnancy, there's a whole spectrum of operations that we have available, and it depends, of course, on what the appearance of their breasts is. In women who've had a minimal amount of change, who've just lost a little bit of volume, have a little bit of concavity or scooping out of the upper pole of their breast, but the breast is not terribly droopy, well then just a breast augmentation alone will often give an excellent result. But in women who've had more marked changes in the appearance of the breast, where the nipple is lower, where the breast is stretched out, where there's a lot of loss of volume, a lot of atrophy, or what we call involutional changes of the breasts, they often are going to require a combination of procedures. Some breast uplift to reshape the skin envelope, and a breast implant or sometimes fat grafting to restore the lost volume. Those patients can be very tricky. We really need to pick exactly the right operation for that woman, something that's going to achieve her aesthetic goals and do it in a safe, reliable way. We want to do an operation that leaves minimal scarring, improves the shape of the breasts, doesn't interfere with nipple sensation, and has a low risk of complications.
Is there a big learning curve of this? I mean, the first 50? I mean, you've done over 100?
There's an enormous learning curve.
I mean, you've done hundreds of these procedures?
Hundreds. It's not, it's...
So is that a fair question, though, to ask how many you've done? And how do they phrase it?
You know, Randy, I think it's more than a fair question. I think it's an obligatory question to ask. And I would just be very direct with the surgeon and say, hey, is this something you do a lot of? How many do you do? And, you know...
But look at their photos, right? You say look at their photos.
Can they show you before and afters? I mean, I can show my patients literally hundreds of breast augmentations that I've done, hundreds of breast uplifts, hundreds of breast reductions, you know, because over a period of as many decades as I've been doing this, I've accumulated a lot of experience. And there's really no substitute in surgery for experience and judgment. That's really what it's all about.
Have you ever taken somebody with extremely droopy breasts and they end up with beautiful breasts?
I have. In fact, I'm actually, now that you're asking that question, I'm envisioning a very specific patient of mine, happens to be, in fact, an intensive care room nurse at one of the local hospitals, who was a very attractive woman, but she'd had 3 children, and she had the most deflated, saggiest breasts I think I've ever seen. I mean, her nipples were down to the level of her belly button. And we did a combination of a vertical breast uplift, or a vertical mastopexy, which is a newer technique, plus a pair of silicone gel implants, and her breasts look amazing. I mean, she looks like a swimsuit model now. It is...
So Mommy Makeover, a little bit of breast, a little bit of tummy tuck, maybe some lipo.
Yep, could, like I said before, all the way from head to toe. Could include things like Botox to get rid of some of those wrinkles and frown lines, often brought on by being a parent, We can do fillers to fill in some of the areas of atrophy in the face, deepening in the nasolabial folds, fill out the lips, giving lips a more youthful, sensual appearance. That's important. Lipo here and there to recontour the face, neck, body, torso, breast surgery, breast uplifting, breast implants,
You
tummy
say
tucks.
it's a younger looking body,
Absolutely.
that you can make their body look younger.
We can, because we can reverse some of those changes that are consequent to aging and to the trauma caused by pregnancy and childbirth. I mean, that is a traumatic experience for the body to go through. It's damaging, and we can fortunately reverse many of those changes now. Restore a youthful appearance. Sometimes we can make patients look better than they ever looked before.
Is that right?
Absolutely.
Are there women that after this, especially since we're talking about breasts, that they're saying my breast never looked as good?
Absolutely.
Is that right? Even before
yes,
pregnancy?
Absolutely. There are women who were never completely happy with the appearance of their breasts. Maybe they just weren't full enough. They didn't have the cleavage they wanted. They didn't have the upper pole fullness that they wanted. And after pregnancy, of course, it's even worse. We do some surgery to restore them to a more youthful and aesthetically attractive appearance. And they'll go, wow, this is better than I ever looked in my life. You know, I didn't look this good when I was 22. So yeah, we can.
So have you done just about more breast lifts or as many as anybody in the world?
I think so. I believe I have.
And by the way, if you're just tuning in, you know, we're talking about Neal Handel, and he's written a medical textbook for plastic surgeons on breast revision surgery, lifting, and you know, you speak from experience. And so what makes yours better? I mean, if you had to say, you know, my breast lifts are better because...
Because
like if a friend of yours, you know, try to say, why are yours better?
Based on my knowledge, my experience, my training, and my judgment.
Okay, good. So if somebody watching this, they're not happy with their body after pregnancy, give you a call.
Please give me a call.
They get to meet with you.
Let's talk about it and figure out a solution to your problem. Try and figure out what goals you have that we can realistically accomplish.
And they could go to your website, which we'll have at the bottom of the
Okay.
screen. They could look at your before and afters, schedule time to talk. Thank you so much for coming on the show. Very
Thank you
interesting.
for having me. Pleasure being here.
I've wanted
Thank
you back on the show. I think I interviewed you, a very brief interview about 8, 9, 10 years ago.
Yes, it was. That's right.
And I've been trying to get you back ever since. So thanks for coming on the show.
I'm glad I got
And
the
somebody
chance.
even said, you finally made it, Randy. You have Dr. Neal Handel on the show. That's a fact. And so I said, okay, I finally made it.
Okay.
You know? So thanks again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com and put in Dr. Handel or Mommy Makeover. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.